your nurse today. I'm going to do a physical assessment on you. Can you tell me your name, please?
Autumn Bond.
And do you know where we're located?
In my house.
And do you know what time it is?
9:45.
And I'm going to have you count by sevens, starting at 0. So count by sevens, and I'll tell you when to stop.
7, 14, 21, 28, 35, 42, 49.
Very good. Okay, the first thing I'm going to do is I'm going to inspect your skin, your hair, and your nails. Okay? So what I'm doing is I'm inspecting your skin. I'm looking at the color. I'm looking for uniformity to make sure it's all the same. I'm checking hair distribution. I'm looking for any scars, any lesions, any redness, any inflammation. Okay, now I'm going to check the temperature. So I'm just going to put my hands on your skin. Okay, now I'm just going to check the texture of it. So I'm just going to feel your skin. Okay, now I'm going to check what's called skin turgor. It's just going to check to see if you're a little dehydrated. Oh, your skin's good. I'm going to check your hair. I'm just looking at the color of your hair. I'm looking at hair distribution. I'm looking for hygiene and any flakiness. I'm just going to touch your hair. Okay. I'm going to look at your nails. Can you hold it up like this? That's checking for clubbing. Okay. Give me your hands. I'm looking at your cuticles. I'm looking at your for any ridges, any cracking, any dryness. Now I'm checking capillary refill. Now I'm going to do the same with your feet. Still looking for cuticles, looking for cracking, any ridges. I'm going to check for capillary refill. Now I'm going to check your head, your face, and your neck. So what I'm inspecting for when I look at your head is I'm looking to make sure that your head is symmetrical to your shoulders. I'm looking at the size and the shape of your head. I'm looking at your facial features. I'm making sure that they're symmetrical. I'm just going to touch your head. Please tell me if there's any pain. Okay?
No.
Okay, good. I'm going to check your sinuses. Is there any pain right here?
No.
Okay, I'm going to check. It's called your TMJ. Can you open and close your mouth? Okay, and your master muscle. Can you clench your teeth? Can you pretend like you're chewing? Very good. I'm going to check your trigeminal nerve. So I'm just going to, this is what it feels like. I'm going to have you close your eyes. I'm going to touch parts of your face, and I want you to tell me if you can feel it or not. Okay? Close your eyes.
Yes. 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 Yes.
Okay. I'm also going to check your facial nerves. So I'm going to have you raise your eyebrows. I'm going to have you scrunch up your nose, purse up your lips. Can you smile? Can you frown? Can you put air in your cheeks and don't let me push it out? Can you close your eyes and not let me open them? Okay. I'm also going to assess your neck. I'm looking for any jugular vein distension. I'm looking at the placement of the trachea. I'm going to look for tracheal tug. I'm going to check your lymph nodes. Just going to feel back here. Okay, now I'm going to check back here, and up here, and down here. Very good. Now we're going to check your thyroid. So what I'm going to have you do is I'm going to have you take a small sip, but don't swallow it. And then I'm going to have you tip your head to the side, and then I'll tell you when you can swallow it. Excuse me. Okay, I'll hold that for you. Okay, I'm going to put my hand here. Put my other hand here. Okay, you can swallow. Okay, and we're going to do it again with the other side. Okay, you can swallow. Okay. Next thing I'm going to check is your eyes. So if I'm inspecting your eyes, I'm looking at the sclera, I'm looking at the pupil, I'm looking at the cornea, and the iris. I'm looking at your eyebrows and your eyelids. I'm looking to make sure they're symmetrical. I'm going to have you do this eye exam. I would like you to cover one eye for me and then read the lowest line you can read.
9, 3, 7, 8, 2, 6, WME XOO 41 2025.
Okay, and now try the other eye and the lowest one you can read.
4, 2, 8, 7, 3, 9 EWM OOX 31 plus 2020.
Very good. Okay, I'm also going to do what's called corneal light reflex. So can you take off your glasses, please? Can you look over my shoulder, and I'm going to shine the light into your eyes. Very good. Excuse me. You can put your glasses back on. I'm going to do what's called, cover, uncover. I'm going to have you cover one eye, and then I want you to focus on my finger. Okay, you can uncover. Okay, now we're going to try it with the other eye. Okay, and uncover. Great, now I'm going to check your peripheral vision. So you're going to cover one eye, and I'm going to cover one eye, and I'm going to move my hand in different directions. And I want you to tell me when you can see it. Okay, are you ready?
Mm-hmm. Now.
Okay, now we'll try the other eye.
Now.
Great. Okay, I'm also going to check for, it's called lid lag. I'm just going to have you look at my finger, but don't move your head. Go up and down. Now we're going to check your 6 cardinal fields of gaze. So I want you to, again, to keep your head still, but follow my finger in 6 different spots, okay? Ready? Okay, great. Now I'm going to check your light and accommodation. So I'm just going to have you take off your glasses, and I'm going to look into your eyes. Okay, and now I'm going to have you look at it way at a distance. And I'm going to have you focus on my finger. Okay, great. I think that's it. So the next thing I'm going to do is I'm going to check your ears, your nose, and your throat. You can put your glasses back on. So the first thing with your ears I'm going to check is I'm just looking for any drainage. I'm looking behind your ears. I'm looking for any lesions. I'm going to palpate your ears. Does it hurt?
No.
No tenderness? Okay, great. I'm going to do a hearing exam. This is a tuning fork. It does not hurt. It produces vibrations that you can hear. So the first thing I'm going to do is it's called a Weber test. So I'm going to activate it. I'm just going to make it vibrate, and I'm going to set it right here in the middle of your head. And then I want you to tell me if you can hear it in one ear better than the other, or if you can hear them both equally. Okay?
I hear them both equally.
Okay, great. The next test is the Renee test, and I'm going to activate it. I'm going to set it behind your ear, and then for a while you'll be able to hear it. So I want you to tell me when you can't hear it any longer, and then I'm going to put it next to your ear, and then I'd like you to tell me when you stop hearing it again. Okay?
Mm-hmm. I can't hear it anymore. I can't hear it anymore. I can't hear it anymore. Can't hear anymore.
Okay, good. Now we're going to do the whisper test. So you're going to cover one ear, and I'm going to whisper in the ear, and I'm going to whisper something, and I'd like you to repeat it back to me. Okay?
ABC. 1, 2, 3.
Okay, very good. Now I'm looking at your nose. I'm just inspecting your nose. I'm looking for any drainage. I'm looking for any deviations. I'm looking for symmetry. I'm going to touch your nose. Let me know if there's any pain.
No.
Okay. I'm checking your nares. I'm just going to look inside your nose. I'm looking for any polyps, any discharge. I also want to check your periorbital area. See if there's any pain. You feel any pain there?
No.
Okay. I'm going to put my gloves on. I'm inspecting your mouth. I'm looking at your mouth. I'm looking at your lips. I'm looking for any dryness. I'm looking for cracking. I'm looking for any sores. I'm going to inspect inside your mouth. Can you open your mouth, please? I'm looking at your teeth. I'm looking for any dental caries. I'm looking for fillings. I'm looking for missing teeth. I'm inspecting your tongue and the roof of your mouth for any sores. Can you say ah, please? I'm looking to see if your uvula is midline. I'm looking at your tonsils. On a 0 to 4 grading scale, I would rate them as a 2, which is normal. Can you stick out your tongue? Wait, go from side to side. Thank you. I'm also going to put this on your tongue. It won't hurt. It'll taste kind of funny. I'm just looking at the base of your tongue, checking for any sores. So stick out your tongue. Stick your tongue out a little more. There we go. On the other side. Okay, perfect. The next thing I'm going to check for is your chest and lungs. Can you take off your shirt, please? Okay, I'm inspecting your chest. I'm looking for any heaves. I'm inspecting the chest. I'm looking for any labored breathing. I'm looking for use of accessory muscles. I'm looking for any lesions, any sores. I'm looking at your anterior, posterior diameter.